coronavirus continues to be the main news, and all the updates then we're going to give you over the next 1 hour. So let's begin with the headlines then. Prime Minister Narendra Modi to address the nation at 8 p.m. today to talk about issues relating to COVID-19 and the efforts to combat it. Chairs a high-level meeting to review the ongoing efforts to contain the coronavirus. Discusses ways to further strengthen India's preparedness. Group of ministers meet in New Delhi to take stock of the situation in India. 148 active COVID-19 cases in India. 14 persons have recovered so far. Health Minister reviews preparedness for containment and management of coronavirus. Also reviews screening facility at IGI Airport and interacts with inbound travellers. Indian Council of Medical Research, ICMR, says no evidence of community transmission of coronavirus in India. Says all 826 random samples tested so far found negative. Following the CBSE, the Council of Indian School Certificate Examination ICSE Board also postpones Class 10 and 12 examinations due to the novel coronavirus threat. Exams postponed till March 31. JEE mains also to be rescheduled and new date of JEE to be announced later. COVID-19 affects over 212,000 people around the world and more than 8,700 deaths in 164 countries. China reports 0 domestic cases for the first time. France reports 89 new coronavirus deaths in the last 24 hours. US media reports 2 US congressmen have tested positive. Italy reports nearly 500 new deaths. Australia declares an emergency. German Chancellor Angela Merkel calls it the biggest challenge since World War II. Supreme Court hears a petition filed by BJP leader Shivraj Singh Chauhan to hold a floor test in Madhya Pradesh. State Assembly says that the governor has the power to direct the speaker to hold a trust vote if the government loses majority. Supreme Court rejects curative petition of Nirbhaya case convict Pawan Gupta on his juvenility claim. Parents of Nirbhaya say that she will finally get justice tomorrow. And former Chief Justice of India Ranjan Gogoi, nominated by the President, takes oath as the Rajya Sabha member. Union Law and Justice Minister Ravi Shankar Prasad says the House has a tradition of having former justices so that they can contribute their best. So here's our top story. Prime Minister Narendra Modi will be addressing the nation today on the coronavirus outbreak at 8 p.m. And during his address, the Prime Minister will talk about issues relating to COVID-19 and the efforts being made to combat it. Earlier on Wednesday, the Prime Minister had chaired a high-level meeting to review the ongoing efforts to contain COVID-19. Ways to further strengthen India's preparedness were discussed. This includes further enhancing testing facilities. Prime Minister emphasized on actively engaging with individuals, local communities and organizations in chalking out mechanisms to fight COVID-19 menace. He also urged officials and technical experts to deliberate on steps to be taken next. The Prime Minister expressed gratitude to all those at the forefront of combating COVID-19, including various state governments, medical fraternity, paramedical staff, armed and paramilitary forces, those associated with the aviation sector, municipal staff, and others. In an outreach through Twitter, Prime Minister Narendra Modi has assured citizens that the government will do everything possible to help the citizens in the outbreak of COVID-19. In a series of tweets, he said, and I quote, "Such efforts are possible due to teamwork, and I also laud those working to make it possible. Working together can lead to good results benefiting so many people. I thank Prime Minister Hasina for sharing her insightful views during the video conference with fellow SAARC leaders." And replying to many tweets posted from a cross section of people, the Prime Minister lauded all efforts being made, making it possible, and he said that no words will ever do justice to their exceptional efforts. Well, in a major relief and boost to India's containment efforts, all 826 random samples that were tested for COVID-19 infection by the Indian Council of Medical Research have tested negative so far. This effectively means that there is no sign of community transmission of COVID-19. The ICMR has said that further scale-up is in progress, and ICMR has begun picking up random samples of those who have been admitted to government medical colleges for respiratory illnesses. The exercise was done to check whether community spread of coronavirus has taken place in the country. And now Arun Sharma will be joining us for more on this. Arun, let's try and put this into perspective. The Prime Minister will be addressing the nation tonight at 8 p.m. The Prime Minister has taken several initiatives, including that video conference with SAARC leaders. So let's try and understand, what is the Prime Minister likely to be saying? You put it all, looking at the recent events, what's the Prime Minister likely to say?
Well, it is very much tough to speculate as of now that what Prime Minister Narendra Modi perhaps will say when he'll be addressing to the nation, because yes, it's an address to the nation, but yes, one thing is for sure, that this is a time when there is a need for precaution and not panic. Now, Prime Minister Narendra Modi is time and again telling these to 130 crore people via his Twitter account. He's been tweeting all this information. Yes. There is no need to panic. It's time to take precautions, number one. So, I mean, if you try to put it into perspective, I mean, what Prime Minister Narendra Modi as of now is doing is, dividing two parts of strategies as of now. Number one, on global front primarily, he's talking with the international leaders, the global leaders, and trying to chalk out the strategy as to how the COVID-19, the chain reaction which has been created globally, that can be stopped globally, because no country is isolated in today's time. That's number one. So we saw that Prime Minister Narendra Modi participating in the SAARC meeting. This was the idea of Prime Minister Narendra Modi himself. And again, now very soon we'll be having the meetings with the G20 leaders. This was also the initiative of the Prime Minister Narendra Modi when he talked to the Saudi Arabia's leadership, and he had a word about these kind of conferences. So on the global level, he's putting it, he's making sure he's taking a leadership role as to how can the coronavirus or the COVID-19 can be combated. Now, on the domestic front, that means on the India front, Prime Minister Narendra Modi is always that he's taking all the initiative to address to the people and to tell them that there is need only for precaution, because at this moment, Mark, we can only combat coronavirus or COVID-19 in one format, and that is to take care of ourselves only, just to sanitize ourselves. That's the must thing. So Prime Minister Narendra Modi has tweeted the journalists, he's retweeted the journalists, he has retweeted the medical professionals who are working round the clock, and he's trying to motivate all these staffs, like medical staff as of now, the aviation staff as of now, which are working, the tourism staff, and he's trying to motivate that there is a time. Indeed. This is a time primarily, it's a testing time, a time for precaution, not for panic, Mark.
Yes, thanks very much, Arun Sharma, with those updates. Very important updates, especially the point about the Prime Minister retweeting several people, giving encouragement to all those who are at the forefront of this particular fight against coronavirus, giving them the motivation to do their job right up to the end. And he's constantly saying that they are doing an excellent job. Now, moving on then to our next story, the total number of active coronavirus cases in India has risen to 148, including 25 foreign nationals. One case each has been recorded from Andhra Pradesh, Odisha, Punjab, Uttarakhand, Puducherry and West Bengal. 45 confirmed cases have been recorded from Maharashtra, the highest in any state. 14 people in all have recovered and they have been discharged. While 3 deaths have been recorded till now, the central government has asked all ministries to install thermal scanners in government buildings. All gyms, recreation centers, creches in government buildings have been closed. Ministries have been asked to discourage entry of visitors to government offices. Visitors and temporary passes have been stopped with immediate effect. Air India has suspended all flights to and from the UK and Europe from today onwards till the 31st of March. A 5-member group of ministers, GOM, on the prevention and management of COVID-19 headed by the Minister of Health and Family Welfare, Dr. Harshvardhan, is meeting in New Delhi today to review measures taken to contain COVID-19 spread and to take stock of the situation. Headed by the Health Minister, Dr. Harshvardhan, this group of ministers will discuss the current situation and deliberate on further steps to be taken. The Cabinet Secretary Rajiv Gauba, besides Union Ministers S. Jaishankar, Hardeep Puri, Dr. Harshvardhan, Ashwini Chaubey are present in this GOM meeting. Now, before entering for this meeting, all the attendees were given sanitizers in a bid to remain safe. And we are joined by our correspondent Nitendra Singh. He's looking at his phone. Nitendra, can you hear me? Yes, Nitendra. So this is an extremely important GOM.
Yes, Mark.
An important GOM that's taking place. They have had several meetings, this may be the 8th meeting of the GOM. So they're basically, taking stock of the situation, preparing us for the next stage perhaps, or, ramping up, gearing up for something. But currently, the good news that you have to give us is that, all the tests that ICMR has done of random testing have all turned negative, which means that community spread has not taken place as yet.
बिल्कुल मार्क, इस वक्त जो है थोड़ी देर पहले ही GOM की बैठक खत्म हुई है। तकरीबन 1 घंटे से ज़्यादा ग्रुप ऑफ मिनिस्टर की बैठक चली, जिसमें विदेश सचिव भी और कैबिनेट सचिव भी इसमें भाग ले रहे थे और सेना के आला अधिकारी, लेफ्टिनेंट जनरल रैंक के अधिकारी भी इसमें शामिल थे, DG ICMR इसमें शामिल थे। और जो अब तक जितने स्टेप उठाए गए हैं और आगे आने वाले जो चैलेंजेस हैं उसको लेकर के क्या कुछ रणनीति बनाने की ज़रूरत है, उस पर चर्चा विस्तार से यहाँ पर हुई। इसके अलावा जो आपने बताया कि सबसे अच्छी खबर यह है कि जो रैंडम सैम्पलिंग ICMR ने किया था उसमें जो उनके सैंपल निगेटिव आए हैं, यानी कि कम्युनिटी में अभी इसका स्प्रेड नहीं हुआ है। ये एक बड़ी खबर है और बहुत ही एक तरह से अच्छी खबर है देश के लिए कि ICMR ने तकरीबन 1000 सैंपल्स रैंडम उठाए थे फरवरी से लेकर मार्च के बीच में। 2 चरणों में 500 के सैंपल उठाए थे और उसकी जो टेस्टिंग की है तो उसमें सारे जो टेस्ट नेगेटिव आए। ये एक बड़ी अच्छी खबर है और ये तमाम कोशिश इसलिए हो रहा है मार्क की भारत की जो कम्युनिटी में इसका स्प्रेड ना हो सके उसको रोका जाए, क्योंकि अब तक जितने भी केसेस हैं वो हैं जो विदेश से, जो संक्रमित देश से नागरिक आए हैं उनको संक्रमण हुआ है या उनके सबसे करीबी परिवार के करीबी सदस्यों में हुआ है। और कोशिश सरकार की तरफ से यही है कि वो फैल ना पाए, स्प्रेड ना कर पाए, वो लोकल लेवल पर ही रह जाए। और इसीलिए तमाम जितने भी दिशा निर्देश, गाइडलाइन जारी किए जा रहे हैं हर विभाग की तरफ से, और लोगों को बोला जा रहा है कि वो भीड़ भाड़ में जाने से बचे, एक दूसरे से कम 1 मीटर की दूरी बना के रखें और लगातार अपने हाथ की सफाई करें, साबुन से फ्रिक्वेंटली हाथ को जरूर साफ करते रहें। ये एक बड़ी बात है। और शाम में जब प्रधानमंत्री आज रात 8 बजे राष्ट्र को संबोधित करेंगे तो और भी वो विस्तार से बताएंगे कि आखिर क्यों ये जरूरत पड़ रही है तमाम कदम उठाने की और क्या आगे की रणनीति है सरकार की, उसका वो जनता को, देश की जनता को सीधे बताएंगे। तो ये एक बड़ी अहम खबर है अब तक।
Yes, Nitendra, so you have basically given us also those guidelines, the do's and don'ts once again, which people have to remember, because that's really at the end of the day because this virus is spread from human to human transmission. If you keep yourself at a safe distance, if you wash your hands, you don't get this virus. But then there is the fear that some people who have asymptomatic can actually be carrying the virus even if they don't show symptoms. Now that is some sort of a concern, but if it hasn't spread into the community as yet, that shouldn't be so much of a concern right now, isn't it?
बिल्कुल कम्युनिटी में अभी नहीं है और वो आगे ना स्प्रेड करे, इसको लेकर के तमाम कदम उठाए जा रहे हैं। आप देख रहे होंगे चाहे वो रेलवे की तरफ से हो, लगभग 150 से ज़्यादा ट्रेन को कैंसिल किया गया है। इसके अलावा स्कूलों में गाइडलाइन जारी की है कि तमाम जो स्कूल कॉलेज उनको बंद किया जाए, तमाम मॉल्स हैं या फिर जिम है उनको सबको बंद करने का निर्देश है। तमाम जो राज्य सरकार है उन्होंने अपनी तरफ से कदम उठाए हैं। लोगों से ये एक तरह से जागरूकता के जरिए ये बताया जा रहा है कि आप सोशल डिस्टेंसिंग करें, आप कम से कम भीड़ वाले इलाकों में जाए। और निश्चित तौर पे प्रधानमंत्री ने संसदीय दल की बैठक में भी तमाम जितने सांसद हैं, जो जनप्रतिनिधि हैं, उनसे अपील की है कि आप अपने क्षेत्र में जाएं, अपनी जनता को बताएं। उसके अलावा लोकल मीडिया का सहारा ले। तो ये अगर जितनी प्रचार प्रसार होगा, लोग जितनी जागरूक इसमें होंगे, उतना ही इस बीमारी को स्प्रेड करने से रोकने में कामयाब होंगे। सरकार की तरफ से मार्क जितने भी स्टेप उठाने थे वो उठा लिए गए हैं। अब जरूरत है जनता की तरफ से कि जनता कितना सहयोग करती है, क्योंकि सबसे बड़ी जरूरत है कि अगर आप खुद का ख्याल रखेंगे तो आप संक्रमित नहीं होंगे, इन्फेक्टेड नहीं होंगे, तो अपने परिवार को नहीं इन्फेक्टेड करेंगे या फिर अपने जो आसपास लोग हैं, रिश्तेदार।
Thank you, Nitendra Singh, for joining us with those inputs. Yeah, so Nitendra then telling us very clearly about the awareness that people need to have, also about social distancing and keeping your fingers and hands clean regularly, keeping a certain distance from people. These are extremely important as things stand to prevent the spread of the virus. Moving on to our next story, then Maharashtra Chief Minister Uddhav Thackeray today said that the state is fighting a war against coronavirus. He added that all precautionary measures are being taken and he's urged people to avoid unnecessary travelling. He stressed that the situation is not critical but worrisome. The Chief Minister also spoke to Prime Minister Narendra Modi, who promised full cooperation from the central government. And for an update now from Maharashtra, we are joined by Shishir Shellar, who's joining us from Mumbai. Well, Shishir, the situation seems to be...
Do not move camera now, sir. The frame is set.
Shishir, can you hear me?
Yes, Mark, I can hear you.
Yes, okay. So, Shishir, I was wanting to know that, it's a matter of, the Chief Minister said the situation is worrisome. It's not critical, but it's worrisome. So, put into context what he said in terms of, and the kind of response that the state government has put out to try and prevent this virus from actually becoming a community spread, because the numbers are quite high in Maharashtra as we speak, relatively speaking.
Well, absolutely, Mark. As far as the numbers are concerned in Maharashtra, which reaches to 49. Yesterday, the number was 47, and now we have seen 2 more fresh cases have included in it. Both the cases have a travel history. One woman traveled from London, and the other man traveled from Dubai. And that's the reason now the numbers have gone to 49 here. And that's the reason the government is also at this point in time is taking ample steps to contain the disease as minimum level as it can. And that's the reason, as I told you, that various steps have been taken here. Social isolation is one such aspect that government is focusing on. The Chief Minister of Maharashtra today categorically said that this is a war against a virus, and that's the reason we should come together to fight with this virus. And that's the reason number of steps also we have been told people to follow here. The one major step is obviously not to travel. The Chief Minister have categorically said that those people don't have any reasons. Actually, they should avoid traveling. They should avoid going to any social places here, be it office, any institution also, or religious places also. Because before that, we have heard that the government have already taken a decision, have closed down the educational institutions also, have also instructed the private offices if they can allow their workforce to work from home. At the same time, the government offices have also been, the capacity of the government hospitals and the offices have been reduced to 50%. Only 50% staff of the government organization institutions are working at this point in time. He also pointed out one thing, that right now the situation, looking at the situation, if the number increase, then obviously the state government will have to take some tough decision. Now, what are this tough decision means that probably he is hinting towards a complete shutdown here. Currently in Mumbai, if talking about, the local trains are working as per their schedule. But if the numbers are increased, then probably we may see that the local trains will also shut down in coming times here. That's what he said. As far as transportation is concerned, the ST buses are working, but again, in the ST buses also, the state transport buses also, the government have given some rules and regulations while people traveling in these buses. If the situation become worrisome again and probably dangerous more, then probably we may see that the complete shutdown in Maharashtra.
Okay.
But this currently situation is under control. That's what the government have said, and probably they will take some more steps as soon as they get some more details. Now, government is now focusing about those who has a travel history, because that's the main contentious issue at this point in time. Because just now the state health minister said that out of 49 cases, the 40 cases has a travel history. And that's the reason government is now in touch with the aviation ministry and trying to curb those passengers basically, or try to get in check at the at the very primary source at the airport, so that those travelers who coming from outside, they can be checked at the airport, and then probably those who need complete facility can be sent to the facility center, or those need to be sent to the quarantine also. The measures can be taken in that regard as well. And that's the reason home quarantine is also been given by the state government here. But now there's so many questions have been raised that how these people will get operated when they're at home, and what are the facilities does government have provided. Answering this question, the state health minister said that at this point in time, the home quarantine people who have been given, who have been stamped earlier also have been kept under observation. The medical team has also been provided to them, and they're under constant observation. As far as the quarantine facility is concerned, he said that not just government hospitals, but many private players have also come into picture, and they've said that they can also provide a support system to the government, and also provide the legal required medical aid to the people also. And that's the reason many private hospitals have started quarantine system, have started giving quarantine rooms also to those people who want to hospitalize them. And that's the reason not just government hospital now, but even the private hospitals is operating in Mumbai. As far as labs are concerned, because that's a very important thing, that because we have seen that the burden has been increased on the labs basically. The NIV, the National Institute of Virology in Pune, have been overburdened now, and that's the reason the state government have asked to get support from the center and to allow them to start some new labs in Maharashtra accordingly.
A very comprehensive answer there, Shishir. Thanks very much for joining us with those inputs. So important points raised by Shishir. One of the important points, of course, is that people have to maintain that home quarantine. Those who have come from abroad must be maintain that home quarantine, because they have there is the threat, of them putting that illness, putting this particular virus out into the community, and that is going to be quite dangerous. So they must maintain that home quarantine, and of course, if they do have symptoms, they should go and get checked also. That is one of the key areas of concern right now, especially in Maharashtra. Now, moving on to our next story. As the coronavirus tally keeps rising in the country, the first positive case was detected in Jammu and Kashmir's Kanyar district in Srinagar on Wednesday. The patient had travelled to foreign countries in the past and had arrived in India on March 16, 2020. The news was confirmed by the J&K Planning Secretary Rohit Kansal. And Jammu and Kashmir has so far reported 4 positive cases, with 3 cases from Jammu division. The Railways has cancelled 84 more trains which will not operate between March 20 and March 31 in view of the coronavirus and low occupancy. And with this, the total number of cancelled trains has climbed to 155. The national transporter had cancelled around 99 trains on Wednesday night. All passengers having tickets in these trains are being informed about it individually. The ICSE board on Thursday postponed Class 10 and 12 examinations due to the novel coronavirus threat. The Council for Indian School Certificate Examinations, the Chief Executive Jerry Arathun, has said that the exams are postponed till March 31. And on Wednesday, the Central Board of Secondary Education postponed the ongoing classes for 10 and 12 examinations till March 31 in view of the coronavirus outbreak. In what is now declared as the new epicenter of the outbreak, Italy on Wednesday reported 475 new deaths for the coronavirus, marking the highest one-day official toll of any nation and taking the death toll to 2,978, with the death rate still climbing. The country also entered a second week under effective lockdown, and while the rest of the Italian population stay at home on lockdown, the livelihood of vulnerable homeless people has become a matter of concern. To combat this, several Red Cross workers have been increasing their daily activities to meet the growing needs of the homeless in Rome. The shutdowns are due to expire on March 25. And on a positive note, Beijing hit by a record number of imported cases of the coronavirus as new local transmission in China fell to 0. It was the first time since the virus took hold late last year in Hubei province, the capital of Wuhan, that China has recorded locally transmitted cases. Now, well, in recent days, China has increasingly focused its counter-epidemic efforts on inbound travelers as the coronavirus rapidly expanded its global footprint. And in Peru's Lima, applause rang out to honor those medics who are continuously battling the coronavirus epidemic in the country. Peru has still now 86 confirmed cases. Meanwhile, the president, Martin Vizcarra, has announced a 15-day state of emergency amid the total closure of the country's border. However, Peru's government has also deployed masked military personnel. This is to block the major roads in Lima. The police have also restricted the movement of people as the country rolled out a state of enforced social isolation to slow the spread of the coronavirus. A Washington-based medical supply company is significantly increasing its production to meet the skyrocketing demand in the wake of coronavirus outbreak. Ventec Life Systems normally produces roughly 200 per month of its life support systems, which help critically ill patients breathe. Now the device, which is named Voxen, will combine ventilation, oxygen, cough, suction and nebulization services into a portable ventilator that can go from hospital to home. So, to control the outbreak, the company hopes to start producing upwards of 1,000 such devices in roughly 3 months' time. The Union Square Hospitality Group in New York laid off 2,000 employees due to lack of revenue, which accounts for over 80% of its total staff. The group has a total of 18 restaurants in New York City, 2 in Washington, and corporate office in Manhattan. Other big employers, including major food group, began layoffs last week when employers were making the difficult calculation of whether to close altogether out of safety concerns or remain open for takeout and delivery in order to maintain some cash flow. In a show of solidarity, Danes have been cheering about their windows supporting people such as police officers. So they've been shouting out from their windows. Health workers, also supermarket employees, all working during the coronavirus crisis. People in Denmark's Copenhagen, they leaned out of their windows to clap and cheer for those still working to help the country stay afloat, as the country has banned large public gatherings. Inspired by people of Italy and Spain, the actor Rasmus Hammerich organized an event and called the people to clap through Facebook invitation. The actor said that around 32,000 people responded to his invitation, and after 3 minutes of cheers and applause, everyone shouted out, "Good night, see you tomorrow," before closing their windows and doors. However, restaurants, bars, cafes and gyms have been closed temporarily to curb the spread of the coronavirus. So we're giving you a global picture here of the coronavirus and how people are handling it. And let's go across to our correspondent Sudhir Das, who has some inputs now. Sudhir, about the new guidelines that have come in. These are guidelines from the Department of Personnel and Training. So give us those guidelines.
जी मार्क, काफी महत्वपूर्ण है ये जो पूरा गाइडलाइन जारी हुआ है सरकार की तरफ से। डीओपीटी का ये निर्देश है और इस निर्देश में साफ तौर पे सरकार की तरफ से ये कहा गया है कि जो हेड्स ऑफ डिपार्टमेंट हैं वो ये इंश्योर करें कि ग्रुप बी और सी के जो एम्प्लॉई हैं उसमें से 50% लोग ही ऑफिस अटेंड करें। तो ये एक जो बात हम लगातार कह रहे हैं सोशल डिस्टेंसिंग के लिए, उसके लिए वो काफी महत्वपूर्ण है, क्योंकि कम लोगों को ऑफिस अटेंड करना पड़ेगा और इसलिए ये पूरी व्यवस्था की गई है। साथ ही साथ ये भी कहा गया है कि जो अल्टरनेट डे पे जो दूसरे लोग हैं, 50% अन्य लोग हैं, वो अल्टरनेट डे पे या दूसरे दिन वो ऑफिस ज्वाइन कर सकते हैं। लेकिन एक तरह से कह सकते हैं जो वर्क फ्रॉम होम की सुविधा है, वो भी सरकारी कर्मचारियों को दी जा रही है इस आदेश के जरिए। जरूरत पड़ने पर सरकारी कर्मचारियों को ऑफिस बुलाया जा सकता है, ऑफिस के बारे में बातचीत की जा सकती है, वो फोन पर उपलब्ध रहेंगे, ये खासतौर से कहा गया है। तीसरी जो महत्वपूर्ण बात इस आदेश में है वो ये है कि जो वर्किंग आवर्स है उसको इस तरह से बनाया जाए ताकि एक समय पर ज्यादा लोग इकट्ठे ना हो। तो तीन तरह के वर्किंग आवर्स बनाने के सुझाव दिए गए हैं। एक क्योंकि 8.5 घंटे की और 5 दिनों की केंद्र सरकार की अगर जो नौकरियां हैं उसमें एक तरह से 8.5 घंटे की नौकरी करनी पड़ती है, 5 दिनों तक ये नौकरी होती है। तो 9 से 5:30 बजे तक, दूसरा शिफ्ट जो है 9:30 बजे सवेरे से 6 बजे शाम तक, और तीसरी शिफ्ट सवेरे 10 बजे से 6:30 बजे तक। तो ये कि एक समय में एक पर्टिकुलर टाइम में ज्यादा लोग इकट्ठा ना हो सके। इसी तरह का जो ये इंस्ट्रक्शन सिर्फ केंद्र या मंत्रालयों के लिए, विभागों के लिए नहीं है, बल्कि जो तमाम अटैच्ड सबऑर्डिनेट ऑफिसेस हैं, जो चाहे डिपार्टमेंट ऑफ फाइनेंशियल सर्विसेज से जुड़े हुए विभाग हैं या डिपार्टमेंट ऑफ पब्लिक एंटरप्राइजेस से जुड़े हुए विभाग हैं, फाइनेंशियल इंस्टीट्यूशंस हैं, पब्लिक सेक्टर अंडरटेकिंग्स हैं, उन तमाम जगहों पर ये लागू होगा। लेकिन ये सिर्फ उन जगहों पर लागू नहीं होगा जो एसेंशियल इमरजेंसी सर्विसेज, जैसे मसलन अस्पतालों की बात की जा सकती है, फायर ब्रिगेड की बात की जा सकती है, पुलिस पैरामिलिट्री सर्विसेज की बात की जा सकती है। तो इस तरह के जो विभाग होंगे उन पर ये लागू नहीं होगा। तो काफी महत्वपूर्ण पहल है। 4 अप्रैल तक फिलहाल जो आदेश दिया गया है मार्च, ये 4 अप्रैल तक ये आदेश लागू होगा। सुजाता चतुर्वेदी जो एडिशनल सेक्रेटरी हैं DOPT डिपार्टमेंट में, जो इन मामलों पर नजर रखता है, पर्सनल एंड ट्रेनिंग मामलों, उनकी तरफ से ये निर्देश जारी किया गया। और जो HOD हैं, खासतौर से जो विभाग के अध्यक्ष हैं, उनको ये कहा गया है कि विभागों के अध्यक्ष और जो ऑफिशियल जो ऑफिस के प्रॉक्सिमिटी में रहते हैं, उनको ये कहा गया है कि वो अपने ट्रांसपोर्ट का इस्तेमाल करें, ऑफिशियल ट्रांसपोर्ट का इस्तेमाल ना करें आने जाने के लिए। तो देखिए काफी महत्वपूर्ण है, ऑफिशियल ट्रांसपोर्ट की बात हो, शिफ्ट में बांटने की बात हो, 50% एम्प्लॉइज को अल्टरनेट डे पे बुलाने की बात हो, ये तमाम जो एक पहल कह सकते हैं जो सरकार सैकड़ों कदम सरकार ने उठाया, उसमें से एक महत्वपूर्ण और जरूरी कदम हमने देखा कि पहले ही जो प्राइवेट संस्थान से, खास तौर से IT इंडस्ट्री के लिए सरकार ने नियमों में ढील दी थी, ताकि जो वर्क फ्रॉम होम है, हमको पता है कि भारत में IT इंडस्ट्री में 50 से 60 लाख लोग कार्यरत हैं, उनके लिए वर्क फ्रॉम होम की सुविधा उपलब्ध कराई थी सरकार ने नियमों में ढील देकर। और ये पहली बार इस तरह से, एक तरह से कह सकते हुआ है सरकारी कर्मचारियों के लिए, केंद्रीय कर्मचारियों के लिए।
Obviously, it is the first time, Sudhakar, and because the situation that has arisen has demanded it, so naturally it has to be the first time that such an order has been issued by the DOPT. Very significant order by the DOPT, basically to reduce staff to work in shifts, asking people to use their own vehicles. Important. Also obviously another very important point is that this does not apply to emergency services like hospitals, some of the paramilitary forces, people who are required to work around the clock. So thanks very much for those inputs, Sudhakar. Now we are joined in the studio by Dr. Sudhir Kumar Jain, who is the additional director of the National Center for Disease Control. Thank you very much, Dr. Jain, for being with us. Let's try and understand the way we are tackling this, this virus. We are keeping it out of the community, and we are doing everything we can to do so. What advice would you give people, because they need to understand the importance of trying to keep this out of the community, and ultimately it is the role of the people to keep it out of the community, because if they play by the rules, then we can all survive. In that sense.
Yeah. As far as situation in India is concerned, we are still in stage 2. As you have seen that the more than 800 samples tested by ICMR for general non-affected people, they have been found to be negative. So there is no need to worry, no need for panic, but we have to remain alert and we have to follow the instructions of government. And to avoid that the community transmission is not there in the in India, we should follow all the instructions which are issued by government time to time, like following those measures of social distancing. Already schools and colleges have been closed.
Yes.
So parents should not take that this is a picnic time. They should not take the children out.
Exactly.
Try to stay as far as possible inside your home. Do not go. Unnecessary travel should be avoided, and other precaution like hygienic measures you have to take, like frequent hand washing, which we have been advocating right from beginning, with soap and water. You have to do it, because before touching anything in the house, or if you are coming out of from outside, as soon as you are coming in the house, you should wash your hand. And then precaution while coughing, sneezing, etc. You should use a tissue paper, or if tissue paper is not there, then your elbow, like this, you should use, because this is the part which is least in contact with anybody else. If you cough or sneeze like this, then you are going to touch anything, and it will get infected, and virus will spread from one person to another person. So far situation in India is concerned, we are very much concerned, but definitely it is under
Everything
control.
under control.
Yeah.
Yes, but Dr. Jain, people who are coming in from areas where the virus has been, or people who have any international travel actually now, because we never should know where the virus has been. They could get it even in planes, they could get it at airports. These are the issues. So those people, are potential carriers of the virus, and they, sometimes they pass the thermal screening, they think they are fine. But this home quarantine is extremely important, isn't it, for them? And they should actually maintain that, because they are actually potential carriers of the virus, isn't it?
Yes, you are absolutely right. Those people who are coming from after international travel, especially from those countries where community transmission is going on, they should not feel that once they have crossed the airport, and because at airport we are just checking the temperature by a thermometer. So they may be in incubation period during that period, and they may not show any sign and symptoms. So what they are advised is, after going to home, they should remain separate from other family members, if preferably in a separate room, and use mask for next 14 days. And if they develop any symptoms, then they should immediately contact the helpline of Government of India and tell about their symptoms, and next action will be immediately communicated to them.
Right, and also one of the concerns is that people don't seem to have any symptoms at all, but they can be carriers of the virus. There are some people who seem to have some sort of immunity to the virus, but they are still carrying it. Is that, is this scientifically proven, these asymptomatic carriers of the virus?
Yes, asymptomatic carrier has been found in few studies, in few places, but this is not very rampant at the moment. And we do not know whether these asymptomatic carriers, how efficient transmitter they are. So at the moment, let us do all those steps which have been told, that those who are coughing and sneezing, we must maintain distance from them. Those people who are coughing and sneezing and having cold-like symptoms, they should use mask. There is no need for mask for general public and healthy people, but those who are coughing and sneezing, they should use mask. And as far as these asymptomatic carriers are concerned, at the moment we should not worry much.
Okay, and also people who are in the risk category, elderly people, people with diabetes, hypertension, what are the particular precautions they should take, and also healthcare workers who are working with some of these people who may be already indisposed in some way or the other. I mean, they may not have coronavirus, but they could be requiring medical care for some other reasons. What kind of precautions should people be taking?
Yeah, elderly people, they are at high risk of because they are suffering from many other diseases like hypertension, diabetes, and it is that the diabetes or blood pressure, it gets worse during when they suffer from coronavirus disease also. So they should properly take care of themselves. They should avoid contact with anybody outside from their house, and they should not go out of their house also. They should use mask if somebody in the house is ill, and these elderly are advised to use the mask during that time, so that they do not catch the infection. In case they catch the infection, it has been seen that so far that mortality is high among those who are elderly and those suffering from other diseases also. So usually these elderlies, we advise that they should remain at home, and they should take care control of their blood pressure, diabetes, and other illnesses which they are suffering, and follow the advice of health workers. Regarding health workers, which you have asked that what precaution they should take, these health workers are also those who are taking care of elderly. They are also advised that they should wash their hand. They should not, like, touching from one person, then again without washing hand they touch the other person.
Right.
No, they should wash their hand with sanitizer. They should sanitize the hand and then only touch the person, so that infection from one person is not transmitted to other one.
Another aspect, is the use of gloves by certain sections of society. Even in petrol bunks and things like that, they are using gloves. But the point is that the glove may protect you, but it doesn't protect the other people, isn't it? So it's a question of to what extent can one use these gloves, and or should they, actually not use gloves and continue to just wash their hands regularly?
Yeah, use of gloves is not advisable for general public and those who are doing their routine work. Only the healthcare setting and those who are doing certain hazardous work, we advise them to use gloves. But for general public, it is not advisable. It will give a false sense of protection to them, because gloves, they will touch any surface with those gloves, and they can then get themselves infected also. So there is no point in using the gloves by the general public.
Right. And we need to understand that the government continues to bring out several guidelines to, especially in the work environment. Today the DOPT has also brought out a guideline asking government offices to reduce their staff currently for the time being, also to work in shifts so that they're less, so that social distancing can be maintained. How important are these guidelines at a time like this, when actually the government offices are quite populated in a sense? They have a lot of people.
Yes, you are right. The government, it is basically the way to increase this social distancing, and already the advisory has been issued that those who are not doing any emergency or critical services, they should stagger their time, like 3 times different timings are there of the various offices of the government, so that during transportation in metro or buses there is less crowd. And then in the offices also, the people have been advised to work 50% of group C, D people have, as per DOPT, they are advised to work from home. And so these type of measures will definitely decrease the person to person transmission of any infection, including coronavirus infection, if it is there in the community, and it will help us in delaying the community transmission in the community.
Now, talking about public transportation, Dr. Jain, lots of people have to use public transportation, and they do get crowded. They have got crowded in the past, but now to maintain that certain distance within in public transport, or what are the kind of protections one can have, because that's a place you can actually get infected if if it reaches stage 3. Could you actually have do masks protect you in public transportation?
No, we do not advise mask to be used for the healthy individuals.
Yes.
Mask has to be used only by those who are suffering from any cold, or they are coughing or sneezing. They should use the mask rather than everybody else.
Okay.
So if you find anybody in the public transport is coughing, sneezing, or not well, you can politely say that, gentleman, that kindly use the mask. And if he is not using the mask, you can stand little away from that person. And again, other hygienic practices you have to maintain, like washing hands and other which we have been telling right from the beginning, that you have to maintain your hygienic practices and don't cough and sneeze at any places.
That's also important. The question of coughing and sneezing. Also, one of the practices that has been widely prevalent to a large extent and which should be stopped is spitting. People spit, and that is something that must stop at least. It must stop all the time, actually, but it should definitely stop now.
Yeah, spitting is definitely very bad, and it has been there. We have been trying to discourage spitting, but now it is very risky also if everybody starts spitting as they are doing earlier. So people are advised, they are requested also not to spit in public places.
Dr. Sudhir Kumar Jain, thank you very much for joining us and helping us understand the coronavirus situation and helping us understand our role in keeping ourselves safe and our country safe. We're going to take a short break. Stay with us.
दुनिया में कई काम बड़े मुश्किल है, जैसे कि चंद मिनटों में चांद पर पहुंचना, टूथपेस्ट में पेस्ट को वापस डालना। और भैया एक काम है जो है बेहद आसान। अरे भाई वही आधार कार्ड में अपना एड्रेस अपडेट करना। इसके लिए बस आपको UIDAI की वेबसाइट पे जाना है, अपना आधार नंबर डालकर OTP जनरेट करना है, फिर फॉर्म में OTP डालकर अपडेट एड्रेस कर कंफर्म करना है और लो हो गया आपका आधार में एड्रेस अपडेट। आप भी आधार अपना लो, फायदे में रहोगे।
सफर कैसा रहा अम्मा?
बहुत बढ़िया। बिरजू बेटा, बहू कह रही थी इस बार अच्छी मजदूरी मिली है तुझे।
मिली तो है।
पापो छुट्टी के लिए कुछ जेवर वेवर लाए कि नहीं?
लाए हैं।
सोने के बूंदे,
हाँ।
अंगूठी लाए हैं।
उससे बड़ी चीज
तो क्या लॉकेट?
उससे भी बड़ी।
सोने का पहाड़ ले आया क्या?
अरे पहाड़ नहीं अम्मा, फुहार लाए हैं, वो भी स्वच्छ पानी की। अब गंदे पानी से बीमार न पड़े, इसकी जिम्मेदारी बाप की तो है।
ये तो सोने से भी अनमोल है।
देश उम्मीद से है, करो पोषण।
पिता हो तो बिरजू जैसा, जो जानते हैं कि शुद्ध पीने का पानी और घर की स्वच्छता दोनों जरूरी है बच्चे की अच्छी सेहत के लिए।
संतुलित और पोषक भोजन जरूरी है, विशेष रूप से महिलाओं और नवजात शिशुओं के लिए। यही हमारे समाज के भविष्य की नींव है।
पोषण के 5 आधार: स्वच्छ हो घर संसार, आहार हो खूब अच्छा, रहे 10 से दूर बच्चा, खून में कमी ना हो, 1000 दिन पोषण दो। पिता होने की सच्ची पहचान, पालन के साथ पोषण का भी ध्यान।
नमस्कार, मैं NSO से सर्वे के लिए आया हूँ।
आइए।
मधु, क्या तुम्हें NSO के बारे में पता है?
हाँ बिल्कुल, NSO का काम घर घर जाकर स्वास्थ्य, शिक्षा, घरेलू खर्चे, कृषि, रोजगार, बेरोजगारी जैसे सामाजिक आर्थिक विषयों पर सर्वे करना है।
हाँ, और मैं बताना चाहूँगा कि सर्वे को लेकर आपकी पहचान गोपनीय रखी जाती है। NSO सर्वे भारत सरकार की विकास और कल्याण की नीतियाँ और योजनाएं बनाने में प्रयोग होते हैं।
गुड, और इसलिए हम आपके हर सवाल का जवाब बिना किसी झिझक के सही देंगे।
करें विकास में भागीदारी, NSO को दें सही जानकारी। नेशनल स्टैटिस्टिकल ऑफिस, भारत सरकार।
Welcome back. The BJP leader Shivraj Singh Chauhan has said that the delay in the floor test in Madhya Pradesh is just an excuse for the Congress party to get some time as they have lost the majority in the House. He added that truth and justice will prevail as the BJP has full faith in the Supreme Court.
हम आराम से हैं, विधायक आराम से हैं और आने वाले समय को देखते हुए जनता भी आराम से है। सत्य की विजय होगी, न्याय की जीत होगी। अब वो जान गए कि संख्या बल उनके पास नहीं है, बहुमत खो चुके हैं, जमीन पैर के नीचे से खिसक गई है, और इसलिए बहाना बना के और कुछ दिन काट लो और कुछ और नियुक्तियां कर दो, केवल इसलिए कर रहे हैं। लेकिन न्याय की और सत्य की जीत होगी। माननीय सर्वोच्च न्यायालय पर हम सबका विश्वास है।
The Supreme Court is hearing the petition filed by one of the death row convicts in the Delhi gang rape case, Mukesh Singh. Earlier today, the Apex Court rejected the curative petition filed by another, Pawan Gupta, against the dismissal of his juvenility claim. A 6-judge bench headed by the Justice N.V. Ramana dismissed the plea, saying that no case is made out. On March 5, a trial court issued fresh black warrants for the execution of all the 4 convicts in the case, Mukesh Kumar Singh, Pawan Gupta, Vinay and Akash, in Tihar jail at 5:30 a.m. on March 20. All the convicts have exhausted their legal remedies and constitutional remedies with the filing of their mercy petitions, which have been rejected by the President. Asha Devi, mother of the 2012 Delhi gang rape victim Nirbhaya, has said that Nirbhaya will finally get justice tomorrow. Now, after the High Court dismissal of the plea, Nirbhaya case convict Mukesh Singh also moved the Supreme Court, claiming that he has not that he was not in Delhi, in fact, at the time of the crime in Delhi, which was December 2012, and has subsequently also dismissed the claim by the convict. That has also been dismissed. Now, Vikas Sarthi is joining us from the Supreme Court with an update. Well, Vikas, some unusual last-minute pleas there in the Nirbhaya case, but you know, all legal remedies have been exhausted, and the execution will take place tomorrow at 5:30 as things stand.
Right, Mark. In fact, all of the 4 death row convicts have exhausted their legal remedies, but still they are filing some kind of petitions in Patiala House Court, in Supreme Court. In the morning, Supreme Court dismissed a curative petition filed by Pawan Gupta, where he claimed that he was a juvenile when this incident occurred. In fact, Supreme Court had already rejected those claims, but he filed a review petition that was dismissed, and again, he, as a legal remedy, curative petition was available to him, and he exercised that legal remedy as well. Today, Supreme Court rejected curative petition as well. Meanwhile, one of the death row convict, Mukesh Singh, also challenged the order of death sentence. He said that he was not in Delhi when this incident of gang rape and murder occurred. He claimed that some evidence was not given by Delhi police to him, and he wanted a kind of reopening of the case. Supreme Court rejected all these claims. Court said that you have said everything at the stage of trial, and not only the trial court but Delhi High Court also examined all those arguments, and there is nothing for Supreme Court to interfere with. Accordingly, court has dismissed Mukesh Singh's plea as well, but still some petitions are pending at Patiala House Court and are being heard by the lower court.
Yes,
so they are trying to buy some more time. They are filing several petitions either in lower court or in the Supreme Court.
Right. Thanks very much, Vikas, for those inputs. So they are trying to file petitions, but all their legal remedies have actually been exhausted. So let's move on then to our next particular story, which is on Life Prime. This is our new segment, Life Prime. That's stories about art, culture, etc. In Paris, streets surrounding the famous landmarks there have remained empty, with just a few cars seen on the roads after a government lockdown was put in place. The French government put its 67 million people under lockdown in an unprecedented act during peacetime. The lockdown came in force after an almost 20% rise in deaths in just 24 hours. The fast-spreading disease, the coronavirus, that jumped from animals to humans in China, has now infected 212,000 people in the world. It's caused 8,700 deaths in 164 nations, which has triggered emergency lockdowns and injections of cash unseen since World War II. So a lockdown there in France. Well, in the end, we leave you with visuals of Rio de Janeiro's Christ the Redeemer. The world-famous landmark is closed to visitors following the COVID-19 outbreak, but it sent a message nonetheless that the world is united in the fight against the deadly virus. Take a look at the light show, which projected the flags of afflicted countries upon the isolated statue. Take a look at this. Thanks very much for watching. Namaskar.